Dr. M.I. Sahadulla, KIMS Healthcare. You are a regional healthcare king. Now, first of all, how do you scale up healthcare in a region? Do you feel talent shortages, difficulty in getting people from other parts of the country to come in? And second, it's an allied question. How has regional healthcare or private healthcare done so much better in the south than in the rest of the country, particularly our politically super powerful north?
All right.
Which is going to get more powerful after the next census.
Thank you. Thank you, Shekhar. And can I take a minute? Actually, I want to thank all the organizers, Dr. Mahajan, Dr. Varun, not Varun, no, Dr. Mr. Varun, and all the organizers for a fantastic conference.
Varun ko doctor keh sakte hain.
Yeah, we are confident. Yeah, I think we started almost, Dr. Mopan and myself.
You were meant to be on this stage, but you chickened out, yes.
Yeah. So we started almost the same time the health service in a bigger way over there, and certainly we followed. We got the courage from the pathbreakers like Dr. Reddy, and in the government sector, I should say. Also, I should mention one name is Dr. Valyathan, who has really created a good model in the Srijitra Center in Trivandrum. So I think that gave a lot of confidence for us, and that is how we went ahead and started this. The regional, always there's a question whether we can go to the, it's always metro. The metro code is attached always with a better healthcare. And, but we really ventured to start in a tier 2 town. And in fact, we spread out from tier 2 town to tier 3 and even rural areas. And many of our hospitals are quite rural areas. And so why we ventured is because we had feeling that there's a requirement of quality healthcare and modern healthcare there. But I also should say that the metal was ready for the maker's hand, as it said in Bible. Because the Kerala is very, very politically charged, as you know. Many people will not try private investments there at that time, at least, and now it is changing very fast. But the people were very aspirational. They want a better healthcare, and they have a very good education and exposure to the outside world. So we thought that we also had some experience outside, and we thought that this is a time where Kerala is ready for a good healthcare.
But international collaborations help with regional healthcare?
International collaboration certainly helps with the regional healthcare, but when we started, there was no international collaboration and there was no bank collaboration also, right. Because many people believed that Kerala is not the place to start healthcare big way.
I will tell you a story about that, but please go ahead.
So I have gotten, we have stood for appointments with the banks, and so I think from that stage things have improved, and people received it very well. And you were talking about quality. Quality is always in the eyes of the beholder. It's with the beholder. So the patient experience is what matters. And so we have created a model by which the quality is experienced by the patients. There are so many measures now, there are so many metrics now by which we can measure quality. And however, we always get the feedback of the customer, and that is the most important thing. So for example, we have invested much more than probably the region will need. Cancer is very high in Kerala, and the WHO says that it's only about 1 million you should have a LINAC. But we invested more relaxed, even for like 6 lakhs population, not even 10 lakhs. And found that people use it, and when it is judicially used, and we build up trust with the public. So that community connect and building up trust was an important factor. With a sensitive population who is ready to receive a quality care according to their expectation. I mean, quality also actually comes up depending upon the people's demand, and that's where you are saying about awareness. So the awareness is better, they demand better quality. So then the doctors and the entrepreneurs also rise to the occasion to give a better quality. We started the same model we started in Nagarkoil, which is a tier 3 town. And in about 6 to 9 months, it was a real runaway success. And that's because it was given with the, that kind of a healthcare under the same roof with that quality aspect emphasized was not available. So people were very ready to accept it. So in fact, people are more sensitive, if I say so, than doctors, in fact, in getting this.
That's a good point. I know that we can go on and on, but